For many of us, stepping into the shower feels like the perfect way to start the day. But if you're over 60, the early morning hours, especially between 6 and 10 a.m., are when your heart and brain are under the most pressure. Doctors call it the morning surge, a natural spike in blood pressure that makes strokes and heart attacks 30 to 40% more likely than later in the day. Now imagine adding hot water, sudden temperature shifts, or showering right after a meal or medication. These everyday habits can quietly push your circulation over the edge, leaving you lightheaded, unsteady, or even at risk for a fall. The good news is, with a few simple changes, you can make your mornings safer, protect your independence, and keep your heart strong. Number 1. Hot showers. Right after waking up. For many people, stepping into a hot shower first thing in the morning feels comforting. But if you're over 60, this habit can quietly put your heart and brain under extra stress. Here's why. Hot water causes your blood vessels to expand. When vessels widen, blood pressure drops, and circulation to the brain slows down. On its own, that can already make you feel lightheaded. Now, combine that with the morning surge. Between 6 and 10 a.m., your body naturally experiences a sharp rise in blood pressure as it shifts from rest to activity. According to the CDC and NIH, this is the window when strokes and heart attacks happen 30 to 40% more often than at other times of day. So picture this. You wake up, stand up quickly, your pressure spikes. Then you step into very hot water and your vessels suddenly relax. That clash of forces can cause a rapid swing in blood pressure, leaving you dizzy or even knocking you off balance. And the danger isn't just theory. A study published in the Journal of Hypertension found that in adults over 60, showers hotter than 104 degrees or 40 degrees caused an average drop of 15 mmHg in systolic blood pressure. That's enough to make the room spin, especially if you're already on medication or haven't had water yet. So what can you do instead? Keep your shower comfortably warm, not steaming hot. Give your body 30 minutes after waking up before heading into the bathroom. And always drink a glass of water first. Rehydration helps steady your circulation. With these simple adjustments, you still get the comfort of a morning shower, but without the hidden risks to your balance, your brain, or your independence. Number 2. The cold shock at the end of your shower. Some people swear by finishing a shower with a blast of cold water. They say it wakes them up, boosts circulation, or even strengthens the immune system. But if you're over 60, this sudden jolt can do more harm than good. Here's why. When icy water hits your skin, your body goes into what scientists call a cold shock response. Your heart rate shoots up, your blood vessels squeeze tight, and blood pressure spikes almost instantly. That reaction might not matter much in your 20s, but later in life, especially if you have high blood pressure or heart disease, it can push your system into dangerous territory. The American Heart Association warns that sudden changes in temperature can trigger irregular heart rhythms, also called arrhythmias. For someone with hidden heart problems, that stress can feel like palpitations, chest tightness, or dizziness. In rare cases, it can even set the stage for a heart event. Think about it this way. Your heart is already working harder in the morning because of the morning surge. Now add a shock of freezing water, and you've doubled the demand in just seconds. So, what's the safer choice? If you enjoy the refreshing feeling of cooler water, don't jump straight from hot to icy. Instead, gradually lower the temperature over 20 to 30 seconds so your body has time to adjust. Keep the water cool, not freezing, and listen to your body. If you feel lightheaded or your chest feels tight, stop right away. Remember, the goal of your morning shower is to feel steady, refreshed, and ready for the day, not to shock your system into overdrive. A small change in your routine can help protect your heart, your balance, and your independence for years to come. Number 3. Showering too early without water or food. It might feel natural to roll out of bed and head straight to the shower, but for adults over 60, showering too early, especially between 5 and 9 a.m., without first drinking water or having a light snack can create real risks. Here's the problem. During the night, while you sleep, your body quietly loses half a liter to a full liter of fluid through breathing and sweat. That means by morning, you're already starting in a mild state of dehydration. Now imagine stepping into a warm shower at that exact moment. Your blood vessels expand, your circulation shifts, and your blood pressure can drop suddenly. This is what doctors call orthostatic hypotension, a sudden dip when standing up or changing position. The result? You may feel dizzy, lightheaded, or even lose your balance. And research backs this up. A study published in PubMed Central found that even mild dehydration can reduce blood flow to the brain and increase the chance of falls in older adults. That's especially dangerous in the bathroom, where a slip can mean broken bones or a long recovery. So, what's the safer way? Before you shower, drink a glass of water to restore hydration. If your mornings tend to be shaky, add something small and light, like half a banana or a few crackers, to give your circulation extra support. And don't rush. Give your body at least 15 to 20 minutes after waking to adjust before stepping into the bathroom. These small adjustments, rehydrating, fueling lightly, and pacing yourself, can make a big difference in keeping your mornings safe, steady, and fall-free. Because the goal isn't just to wake up clean, but to start the day strong and independent. Number 4. Showering right after a meal. For many of us, it feels natural to eat breakfast and then head straight to the shower. But for adults over 65, that routine can create a hidden risk called postprandial hypotension, a sudden drop in blood pressure after eating. Here's why. When you finish a meal, your body shifts blood flow towards your stomach and intestines to handle digestion. That means less blood is available for the brain and muscles. In most younger adults, the body balances this out. But in older adults, that balancing system is slower and less effective. A large meta-analysis published in The Lancet Healthy Longevity in 2024 found that about 40% of people over 65 experience post-meal drops in blood pressure. Now imagine adding a shower on top of that. Warm water expands your blood vessels even more, spreading circulation away from your core just as digestion is demanding extra flow. The result? Your blood pressure may fall sharply, leaving you lightheaded, unsteady, or even at risk of fainting. That's especially dangerous in the bathroom, where a single slip could mean a fractured hip or a long recovery. So what's the safer choice? Instead of rushing, give your body at least 30 to 45 minutes after a meal before stepping into the shower. Use that time to hydrate, move gently, or take care of light tasks around the house. And when you do shower, keep the water comfortably warm, not too hot to reduce extra strain. By spacing out your meals and your showers, you not only protect your circulation, but you also keep your mornings calm, steady, and safe. A small change in timing can help you stay independent and enjoy your day with confidence. Number 5. Showering right after blood pressure or water pills. Taking your morning medication is important, especially if you're managing high blood pressure or fluid retention. But stepping into the shower immediately afterward can quietly set you up for trouble. Here's why. Most blood pressure medicines, along with diuretics, often called water pills, are strongest in the first 30 to 60 minutes after you swallow them. That's when your blood pressure is most likely to dip. On its own, that drop might leave you a little lightheaded when standing, but combine it with the warmth of a shower, which makes your blood vessels relax even more, and the effect can multiply. This is what doctors call orthostatic hypotension, a sudden fall in pressure when you stand or change posture. The Cleveland Clinic Journal of Medicine reports that medication-related blood pressure drops are a leading cause of falls and injuries in older adults. And the bathroom is one of the most dangerous places for a fall. Hard floors, sharp edges, and water all increase the chance of serious injury. So, how do you stay safe? First, give your body time. Wait at least 1 hour after taking your blood pressure or water pill before heading to the shower. Second, hydrate with a glass of water. Diuretics make you lose fluids quickly, and staying hydrated helps steady your circulation. And finally, add simple safety tools like a shower chair, a slip-resistant mat, or grab bars for extra support. By pacing your routine and respecting your medication's timing, you protect not just your blood pressure, but also your balance and independence. Because the goal isn't just to stay clean, it's to stay strong, steady, and safe at home. Number 6. Standing too long under a warm shower. A warm shower can feel soothing, but for older adults, standing too long under that steady stream of water may quietly put your circulation at risk. Here's what happens. When you stand still for several minutes, blood naturally begins to pool in your legs. In younger people, the body quickly tightens the veins and raises the heart rate to push blood back toward the brain. But after age 60, those reflexes often slow down. Add warm water, which further relaxes your blood vessels, and the result is even less blood returning to your heart and brain. This sets the stage for orthostatic hypotension, or OH, a sudden drop in blood pressure when standing upright. The BMJ reported in 2023 that OH affects 18 to 25% of adults over 65 and is directly linked to dizziness, fainting, and falls. And the risk doesn't stop there. Older adults with OH are also more likely to experience cardiovascular events. Think of it this way. The longer you stand motionless in a warm shower, the more your legs act like reservoirs, holding blood that your brain urgently needs. So how can you protect yourself? First, keep your showers short. Aim for 5 to 10 minutes instead of lingering. Second, move your legs occasionally, flex your calves, or shift your weight to help keep circulation going. And third, consider lowering the water temperature slightly. Even a mild adjustment from hot to warm reduces unnecessary strain on your blood vessels. By making these small changes, you don't just protect your blood pressure, you also reduce your chance of a sudden fall, keeping your mornings safe, steady, and full of energy. Number 7. Tilting your neck back while washing hair. For most of us, leaning back to rinse our hair feels like a normal part of showering. But for adults over 60, this position can sometimes carry a hidden danger. Doctors have even given it a name: beauty parlor stroke syndrome. Here's what happens. When you tilt your head too far back or twist your neck sharply, the vertebral arteries in the back of your neck can become compressed. Those arteries are like pipelines carrying blood to your brain. If the flow is squeezed too tightly, circulation can drop, leaving you dizzy, unsteady, or in rare cases, triggering a small stroke. PubMed case reports confirm that while this syndrome is uncommon, it's very real, especially for older adults with existing vascular issues. Think about the shower. Hot water is already relaxing your blood vessels, your circulation is shifting, and then you suddenly cut off blood flow to the brain by bending your neck the wrong way. It's the perfect storm for lightheadedness, or even a fall. So, what's the safer option? Instead of leaning your head way back, try keeping your neck in a more neutral position. You can bend at the knees, lower your head forward under the water, or use a detachable shower head to rinse without straining your neck. If flexibility is limited, a simple shower chair can give you stability while you adjust positions more safely. The goal isn't to scare you, but to remind you that even small changes in posture can protect your balance and reduce strain on your circulation. By staying mindful of how you move in the shower, you're not just washing your hair, you're protecting your brain, your independence, and your confidence every single day. Connection. Why these shower habits really matter. We've talked about the 7 hidden traps in your morning shower, but let's step back and connect the dots, because the real danger isn't just feeling a little dizzy. It's what happens if you actually fall. According to the CDC, falls are the #1 cause of injury for adults over 65. Every single year, about 1 in 4 older adults will experience a fall. And here's the part most people don't realize. If you fall once, your chance of falling again doubles. The risks snowball quickly. A single fall can lead to a fractured hip, and research shows that a hip fracture increases the chance of losing independence dramatically. Even more concerning, studies reveal that after a serious fall with a hip fracture, the risk of death within the following 12 months goes up by 3 to 4 times. That's why this isn't just about comfort in the shower, it's about protecting your freedom, your ability to take care of yourself, and your quality of life. Think about it. Avoiding those 7 traps isn't simply preventing dizziness, it's preventing the slip that could send you to the hospital, take away your independence, or even shorten your life. That's the true connection between small morning habits and long-term health. By making these small adjustments, you're not only guarding your heart and brain, you're also keeping your balance, your confidence, and your ability to live life on your own terms. So here's the simple truth. Your shower can be safe, steady, and refreshing if you take just a few small steps. First, give your body time. Wait 30 to 45 minutes after waking up, eating, or taking your medication before you step under the water. Second, always drink a glass of water beforehand. Hydration helps your circulation stay steady and your brain stay clear. Third, keep the temperature comfortable. Avoid extremes that are too hot or too cold. Sudden changes put unnecessary stress on your heart. And finally, make your bathroom safer. Add grab bars, use a slip-resistant mat, and consider a shower chair if your balance isn't what it used to be. These aren't big changes, but they can help protect your independence, your confidence, and your health. And remember, this video is for information only. Always check with your doctor to adjust your shower routine or medication timing in the way that's best for you. If you found this helpful, don't forget to subscribe to the channel and join our community for more senior health tips you can trust. Because protecting your heart, your brain, and your balance starts with small choices you can make today.